Hello everyone, I am Dr. Yasir Rizvi. I am working as a senior consultant in nephrology at Dharamshila Narayana Super Speciality Hospital, Delhi. Today I shall be discussing a few things about dialysis. First, we should understand what is dialysis. Dialysis is a medical term that we use for the procedure wherein the blood is filtered out from excess toxins like urea and other uremic toxins from your body. And this can be done with the help of machines, which is called as hemodialysis, or it can be done with the help of your abdominal membrane, which is known as the peritoneal membrane. And this procedure is called as peritoneal dialysis. Next, we need to understand what are the advantages of dialysis. So it is important to understand that patients who have early renal disease, they can be managed conservatively with medications. They need a good BP and a sugar control. But sometimes kidney disease progresses despite all these measures. So once the patient reaches a stage of end-stage renal disease, then apart from these medications, we need to start them on dialysis, because dialysis helps us in filtering out the excess toxins which cannot be taken care of by the medications. What are the complications that can happen during dialysis? A patient who is started on dialysis, they can have some fluctuation in blood pressure. So patients can have some hypotension, which is the fall in blood pressure, or they can even have a hypertension, which is increase in blood pressure during dialysis. Then patients who are on dialysis, they have some tendency for bleeding complications. And sometimes in the initial part of dialysis, patients can have some weakness or some vomiting, but which usually recovers as the number of dialysis sessions are continued. And how frequently is dialysis required? The ideal recommendation is that patients who have end-stage renal disease, they should get at least 3 sessions of hemodialysis, and each session should last for at least 4 hours. However, patients who are on regular follow-up, many of their investigations are reviewed, and sometimes patient can even be maintained on twice a week hemodialysis. Will dialysis cure my kidney disease? So it is again important to understand that dialysis is basically a supportive therapy. It will not have any effect on your kidney disease. So many times patients feel that if they start dialysis once, it will require lifelong. But we need to know that broadly there are 2 types of kidney disease. One is acute kidney injury, where the kidneys can recover if the underlying cause is treated. So in such patients, dialysis can be stopped once kidneys have recovered. However, patients who have chronic kidney disease, where the kidneys have shrunk in size, the chances of revival are not there. So in such patients, once the dialysis is started, it is generally continued lifelong. What dietary prescriptions are required for kidney patients? So patients who have mild to moderate renal disease, they are generally prescribed dietary restriction of proteins, and they need to cut down on their fluid. However, once patients are started on dialysis, they actually need to increase their protein intake, because some amount of protein is also lost in dialysis. And many of these dietary restrictions are actually reduced. And the fluid intake still remains to be decided as per patient's urine output. And all the fine tuning is done by your nephrologist or physician who is following you for your treatment. So what are the vascular access which are required for dialysis? So in general, patients who have advancing renal disease and they reach CKD stage 4, generally we advise them to get an AV fistula made. So this is a small surgical procedure where the artery and veins are directly joined at the level of your wrist, so that the blood flow in your vein increases. So that once the patient reaches the stage of advanced renal disease, it is easy to start dialysis, because for hemodialysis we need a good blood flow in the veins. So that can be achieved by a good AV fistula.